Hello, Busia for me, Pacho, me chicha, ubi biara. Me jidi ye pass and that ye. And then me no better train and komoka creepy a fire pumudin. The topic of this video is sepsis awareness. Ye bedin komo near train ya drain at the abaya rebia. Ekum eni papa ewe UK ha. And so yenta in the womb and komo. My share both within the black and the white community. Yɛntan discuss ɛfa saa yareɛ no ho ɛso sɛ wonam kurom baabiara ɛho science deɛ ɛwɔ hɔ but in terms of verbal communication and awareness wonta ɛhu ɛno na ama mede ba bɛyɛ video wei na mɛtumi prompt the black community bring awareness about this disease and this condition na aboa ama yɛni ada hɔ ne yɛahwɛ yɛn ho soso ɛyie medase bebree sɛ wohwɛ video yi ampakyerɛ like share na subscribe ɛmfama obi na saa video way will be able to save a soul. You might never know how our voices can save soul and how our voices can go far. Help me by sharing this information within the black community. Thank you. Now, topic ben and the be discussed. Me no be discussed topic B about condition me a friend of sepsis. 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 Say oh UK ha most of the ambulances are young sepsis. Call fast and I act fast. I sure most of the ambulances home. But my study has said yentan discuss it. Ewo TV so yentan discuss it. Ewo within the community. Now the best way to give quality care. Say your best chance here. Ewo nipa po nkiti move. Few small group ni educate you. Small group ni educate you. Na ye bibi kese. Okay, and they be taking some opportunity na educate within the black community, especially Ghanaians. Sa yare we ni etimi ehu. And you make offer yare ba na se ayarese bi wo ho ana kwan me na ebetimi afa so na ya prevent ni enkonkonya sa yare bi. Na mpo se wonye bia akwan a obefa so a obetimi enya ayarese a emfa nkofa owu emfa ma. And that's bebree say wa share a subscribe so e dey ama me. Sepsis definition and said the body's extreme response to infection. The body's extreme response to infection. Now, in that process of fighting against infection, the body damages its organs. The body injures its organs, the liver, the kidney, the heart. Okay? And the abra body no air kutia sa infection no obe no na wasan kofa asan kofa yare anaso asan kofa damage fufuro e de abrɛ organs na ɛwɔ yɛ mu no enti nipadua ne de nkonim so fight against infection no but obewie no na wakofa bibi fufuro e de abrɛ yɛ organs no which is even more severe enti ene yɛ ba besua ɛdeɛ na causes sepsis. What causes sepsis? Sepsis na kwa say germs akɔ nipadua no mu na ɛkɔ nipadua no mu na akɔ cause infection. Cause infection is wunya anredro, wunya paracetamol bi no, wunya antibiotic bi no, na ye treat na ye delay away with that infection na your body, your immune system comes back to normal. Okay, but say ye hu ne ntemu a na say infection no koso na infection no air fight against wo organ na afa wo nipadua your immune system no so be arise to fight against that infection. By fighting against the infection no it affects other organs in your system. Okay, now say imagine some organs na our system no sha say enya insusanso bone a or so say wo body temperature wo nipadua wo feeling the way we see feeling ni nyina be sesa no be changes enti we no lead to the signs of sepsis. Obi enya sepsis na suspected sepsis your early signs near what late signs. Some of the early signs are high heart rate. Any panable send a pulse. We call hospital the settle as a near check your heart rate. Okay, the 2 fingers at 2 hand near check your heart rate. Also, depend the heart rate ne keep. Normal heart rate for an adult no between 60 and 100 beats per minute. Okay, but so be in your sepsis and or chassis or show signs of sepsis. The heartbeat maybe to me up 120, 130 a nipa no normally ɛno ɛnyɛ ne heart rate ɛyɛ because there's something going on in the body. There's an inflammatory response. Okay. Number two, nipa no ne blood pressure ɛbɛkɔ fam. Pressure na wɔ sɛ akoma no de pɔmpe emogya no ɛbɛ reduce so. Now your normal blood pressure ɛyɛ between 90 and 140 systolic. Your normal blood pressure between 90 and 140. So wowɔ blood pressure machine bi wɔ fie a ne sɛ wɔawo de bɔ wo nsa number na ɛwɔ soro no yɛfrɛ no systolic. The normal range no was say between 90 and 140. So wo sha say wo show signs of sepsis a wo say wo de no ebekɔ fam below 90. Okay? Obi so a normally can the blood pressure so de no normally be 140 130. But o sha say onya sepsis so no ne de no betime reduce about 90. 90 no though is within the normal range. But what someone say that is not your baseline. And no nye wo systolic blood pressure no. And ka wo normally with systolic blood pressure it be a 130. But because of what started say we show signs of sepsis no. Who say wo systolic ne ebeba be reduce so about 90. And one also say bibi because of nipedium a enye okay. Na eba ne say watch out for other signs. Menka say because of blood pressure ne reducing a sepsis nko a, look out for other factors. Another factor is also having headache. Headache, you feel you feel confused. You feel a bit of disorientation. I say, baby, why pasa? Why you confused? Ebi so ultimate meningitis, uti pio. Ni nyinaa saa signs yi na eba. Look out for all those signs and combine them together and then be able to say, so now I think that way sepsis. This is what I'm talking about. Okay. Another sign is also saturation level. So woko hospital and so woko GP, you will be a dishayensa. Yeah, the show is near checking your oxygen saturation level. And on your oxygen level, mojimu. Okay, normal oxygen saturation level for obia or ye healthy, obia on yarino. The saturation level was say between 95 and above. Okay, obia on yari. Obi oye acutely ill patient, obi o yare out of the hospital. Also, no, the saturation here between 94 and 98%. Okay. Obi so what COPD, chronic obstructive pulmonary disease, and also obi or a respiratory failure, or what I say a home problem no. Or no, the saturation, oxygen saturation level no between 88 and 92. These are the normal ranges. But sir, three categories here of oxygen ya mede ama we. So be esha say or show signs of sepsis a ne de ne be reduce so obi ankoye healthy no obo say oxygen afa ekọ 92, ekọ 91 na ekọ fom. Obo say afa nipa no ono ate say ohome a ensi so. Breathlessness, shortness of breath. And nipa mo say or gasp for air or breath. These are all signs of sepsis. I'm a person who identify. Okay. And you can high heart rate, low blood pressure, high low saturation level, the oxygen level will say na a reduce. So any person will say na or shiver, ne who so. Or to say a what no. And so who then sakanwa, no one ye body temperature, your normal body temperature for a nipa no, your adult nipa no, a year between 36.5 and 37.5 according to the NHS. Nancy so be sure say so or show signs of sepsis. The body temperature never to me rise to 38. Say ye won in term na order so to order so to 39 na air focus so. Elfra kɔso ne nyinaa saa signs ne nyinaa inflammatory response. The body is fighting against some infection, and by doing so, it is affecting some organs in your body. This is why you need to act fast. Sepsis ne nkyere mu nyinaa ani. Now, according to the Sepsis Trust UK 2019, almost saying sepsis no can affect anybody. However, no, there are category of people be say yare we echi omo na condition we echi omo a enye omo pa na affect omo in a very negative way. Enipa bi ti say omo 65 years and above. Why? Because almost immune system, no, as you are growing, your muscle cells decline, your body fluid retention decline, your hydration level changes, your cognitive, you've got cognitive changes, you've got physiological changes into your immune system, no, a year bit compromised. Into obese and this infection, chinwa, just like that. Be a cause very severe. Saa so na nkora nketewa so ɔmo immune system na ɛnyɛ very strong. Nti sɛ yɛbɛhwɛ a during covid no, nkora ne mpanimfoɔ a covid no akyi ɔmo no, they most of them didn't survive because the immune system was not strong enough to fight against covid. Okay, na afei nso yɛwɔ apemfoɔ ne diabetes, obi ɔwɔ type 2 diabetes, obi nso ɔwɔ high blood pressure, hypertension, obi ɔwɔ any chronic anaasɛ ɔwɔ yareɛ bi underlying condition bi dada no, sɛ onya sepsis a because of those factors na ɛwɔ hɔ dada no, wei bɛka ho a, sepsis no bɛka ho a, na ayɛ severe. Nti obi saa no, mepakyɛw woyɛ obi a wo taking regular medication for high blood pressure, woyɛ obi a you are taking insulin for your diabetes, who taking regular medication na wo underlying condition bi a, when you begin to show any of these signs, first thing call the ambulance. If you can drive or if somebody can drive you to the hospital, don't wait for the ambulance. Go to A&E straight. Act fast. Act fast, please. Okay. After so you obi also be a sepsis actually no fee sɛ ɔwɔ saa signs yi ɔkɔ a ɛdɛn na ɛkyerɛ sɛ ɛbɛtumi ahwɛ no mesrɛ wokɔ a yɛbɛhwɛ wo wokɔ hospital a yɛwɔ biribi a yɛfrɛ no sepsis 6 screening anaa sepsis 6 protocol. Yɛwɔ process a yɛde wobɛfa mu to be able to diagnose and detect sɛ ɛyɛ sepsis. Na ɔmo hu sɛ ɛyɛ sepsis a na yɛde wɔafa saa 6 steps yi mu. Number 1, inform senior clinician, inform the medical team say this patient papaya wabi or sepsis. The team must be aware say there's a septic patient on the ward. Okay. Inform senior clinician we are. Number 2, yɛbɛma oxygen because we say you try give you oxygen to sustain you. Send you don't pass out. Yɛma oxygen we are. Now yɛbɛma high concentration of oxygen 15 liters to sustain you. Okay, yɛma enu wie a na afei yɛma cannula IV access. Cannula no yɛbɛ take blood. Okay, na abɛyɛ sɛn abɛyɛ number 4. Okay, yɛbɛ inform senior clinician or the medical team say your septic patient, this patient so presented sepsis. Number 2, yɛbɛma oxygen. Number 3, yɛbɛma cannula. Yɛma cannula we a yɛbɛ take you moja. Number 4, you take you moja. The purpose say you take you moja is to identify the type of infection you came with in order to give you the right antibiotic. Because initially, they omitted ama general antibiotic, broad antibiotic spectrum. Sane friend, and we are general antibiotic between the amount to help stop the activity of the virus or the germ or the infection. But see, a true mojana, a step 4 na. A true mojana near test. I should say infection or a yem. Is it UTI, urinary tract infection? Is it infection from the leg? Is it infection from the throat? Is it chest infection? The who infection and the type of antibiotic, any dose we hear so said the mouth to fight against that infection. Now for yaba number 5. Number 5 no yɛbɛ yɛde yaka number 4. Number 4 no yaka say yɛbɛtwe mogya for antibiotic. Na yaba number 5. Number 5 yɛde nsuo bɛsi so. Yɛhia nsuo na yɛde bɛsi so to keep you hydrated. Number 6 yɛbɛcheck wo lactate ne wo urine. Check your lactate in urine is to able to identify say be our carbon dioxide no and excessive in your blood. Because carbon dioxide is excessive and you can go into metabolic acidosis. Okay, so carbon dioxide and pH level na wo mu no you check na you too high, your body is going is becoming acidotic, and you are going into a process a friend of metabolic acidosis. That process, and I said that stage, your body is going gradually, your organs are failing, okay, and you can go into septic shock. Or into septic shock now, yeah, sure won't tell me, yeah, you can just die, okay. Into sepsis, yeah, dear, it's easy to get it, and yet uncommon to get it. It's really easy to get it. So you'll be a one town row sa, will be a sebi okwe I won't row sa, auto vegetables I won't row home, and also be a because of diabetes or leg infection, and I say leg ulcer. Sa nyoma no wo ho a ɔsɛ wohwɛ anaasɛ obi wɔ hɔ a ɛsɛ sɛ yɛ a wɔda yi kura kyɛ yi a wɔwɔ mu yi. Unya cold no when treating here, it can lead to some sort of infection. Okay, influenza yeah we so we yeah we feel say we ti pa we nyina yeah we say ya born when treating here no one afraid jeep no antibiotic bi anom ana ya mo edro bi anom that germs, can lead into an infection. Leading into infection, the body will try to fight the infection. In fighting the infection, the body can go into a sepsis, affecting your inner organs. Okay, into sepsis and a home communion any. But my person will say, if you are able to identify these signs and call the ambulance, and they are able to treat you within 1 hour, or more protocol be that was say in 1 hour no say it me follow success 6 year me no boss. You be inform medical team, you be more oxygen, you be more cannula, you be true moja, you be so you be check your lactate any urine. Near check is a pH a woman no high and I say lower. You follow sepsis 6 protocol now within 1 hour now. They'll be able to save you. Okay, nti mensuro sɛ wo ho mfa wa wobɛfrɛ A&E. Mensuro sɛ wo ho mfa wa wobɛkɔ emergency, accident and emergency. Mensuro sɛ wo ho mfa wa wobɛfrɛ wo doctor. Now on a normal instance no, enka nipa biara in a year no, ɔsɛ wotumi twi wo mogya once a year. In a year no, was so timi twi mogya at least once for your doctor to check your blood levels, to check your electrolyte, to check your LFT, to check your thyroid, to check say be your immune system. No, yare may affect your immune system. Because most of the yare are deadly no. So yare immune your autoimmune system no unipedua nangasa na ekoso sa yare na. Bibi yare bia befa wakoya, it can affect you because your immune system is compromised. If that's what I say, and it was say once a year, koni entry moja. Mama can say Michelle. I called my GP and I catch my GP and say, for the past 7 years, me dreaming moja da. But every now and then I feel like I'm really tired. I don't know what's wrong with me. And I just want to check my blood. My blood values say changes view or more BBI okay. After so I realized I was losing some hair. Me no me team more. A process I don't know. It could be the weather no changing, but it's very unusual. Sir, maybe me catch me GP, and what he said is, why do you need to get your blood? I say yes because I need it. Oh, sometimes we have to tell them why we think the reason why you person checking. Tell them. Say keep you good communication with them. They catch them or doctor be no be catch us blood test or stop. But we have to approach them because I want check here doctor be no be fro wo fear catch us brother mean check you mojamo. It doesn't work that way. Etienne tries at least once a year. Frewo GP book appointment na ko blood test form. Na ko hospital na entry moja na nhwehwem. 24 hours the results are in. So results never with doctor and frewa, that means everything is okay. Or frewa, then they are coming to tell you what's wrong with you. But message say, well, doctor and frewa, oh friend, nebus and say, how was my blood results? I want to know. Okay, Senebe, you keep up to date with your blood values, you keep up to date with your health. Senebe, if there's any slight change in your system, they'll be able to trace it. Early detection stand the chance of surviving if they're able to detect what's wrong with your body. A bit me as an intem, but see when later your chance of surviving very slim. Mesrel sepsis deadly. Kaisa me say every 1 hour, a nipa saying a nipa 5 and a ewu every 1 hour nipa 5. Okay, by the end of this day, date here will show video we no. By the end of this day no, na a nipa 120 kwana ewu. Enkura wom 65 years and above obi a wanya diabetes obi an immunity enye good so that person can be anybody. Yesra ye ya hokwa ya bo bi man no. Yesra say yenhwe ye ho so yie. Ko hu doctor. After so we obi a wo underlying condition, especially we obi a wo for hypertensive medication, wofa ramipere, wofa amlodipine, wofa losartan, wofa high blood pressure medication bia. Now wafa some medication now for a year. Please go to your GP. Let them review the medication. Ebiana dose na yedi amount ni too high. They have to reduce it. Because sometimes your blood pressure, your ni di ni ya pomodin yenye any activity. Okay, but the moment you start eating well, drinking lots of water, numsio, nante, wo ye exercise, wo say wo blood pressure na kasa no, e betumi stabilize itself. But so wo cost na wo fa medication na yedi amount, wo fa. Your blood pressure is okay, but you are taking the medication for no reason. And at that point, that medication that we take, dose high, it will cause other problem in your body. Okay, so we will be a underlying condition, offer regular medication, maybe a offer insulin for diabetes, offer blood pressure medication for hypertension. Mr. In a year, every year, go and let your GP review that medication. Don't continue taking the same dose. It might be too high, it might be too low. They have to review it to give you the right dose to make sure that you are safe. I hope the video will ever will be. Sepsis is very dangerous. Another time I'll come your way with probably another health condition nearby BCMBB. It's also we share video when we are nurse, we are doctor, we are Ghanini, and I can't say I make it what's I see, what's it. Let's also comment or like a comment section. Now, so far, we name dear winning a channel way. Name what the black community. Let's bring awareness and awareness into the black community. Send a bit me, I share your pomodin a year. Na ya ho wa ya bo me man so. Ya me wu e wo be man so. Ya me nka ye nyina ye ho, no mbo ye ho ba no hwe ye so. That's the ne ye be sin share. Macron.